So we're going to talk a little bit now about Splenius cervicis. Again, it's one of those muscles, because of its position, I actually prefer to needle with, or rather than needle, use my hands to relieve any pain, but I do sometimes needle it. Splenius cervicis, as is written on the package, is going to run, is a splenius. It's a type of muscle, and it's attached to the cervical spine, whereas capitis is attached to the skull. Capitis, capital, capiti, for those that remember your Latin, will be here, that's splenius capitis. Splenius cervicis is going to attach to the cervical spine. Its origin actually starting from the spinous processes, or the transverse processes of T3 to the spinous processes of T3 to T6 vertebrae. And then it's going to run up, kind of runs up and around and inserts into the transverse processes of T1 or C1, C2, C3. So its effect is going to be largely on the spine as opposed to the head. So bilaterally working, it's actually going to extend the neck, and unilaterally it's going to side flex the neck to the ipsilateral side. Remember, it's attaching into the vertebrae itself, not into the capitis. So that's the difference in its orientation and its action. It has a similar sort of referral pattern for the pains that the splenius capitis has. Similar to the test, if you want to just test it, you side flex. But its pain referral patterns, again, will be around, very similar to the capitis, around the eye a little bit, around the outside of the skull, in the middle of the skull. So those are the areas. Again, sometimes you want to needle it, sometimes you would rather massage it, mobilize it. It just depends. So I'm just going to have a look now at some of the angle, because the angle of introducing the needle is a little bit different to splenius capitis. So similar to splenius capitis, we'll get the patient inside lying. We will use a 30mm needle, a small needle, and we'll only introduce it to the depth of the muscle. The needling direction's a little bit different, because obviously with splenius capitis we were here. With splenius cervicis we're going to be in a little bit more medially to the spine. I'd like them to just get him to just lift your head up a little bit from here, and if I can feel it and relax, and again there, and just feel it and relax. I will kind of locate the muscle down here and relax. Introduce the needle lateral to medial direction. So we're kind of going in this direction. And a quick tap. And sometimes it's better to actually, so you don't cause any damage, because you're right around the base of the skull. As well as going laterally medially, try to go anterior to posterior. So just lift your head up again. I can feel it just under my thumb. Take the introducer, place the introducer. I'm going to kind of be going anterior to posterior, lateral medial, and then tap and introduce the needle. I'll show you again how I prefer to treat it, because I rarely needle these, to be honest, but they're sometimes useful to needle. If I can just get the model to roll onto their back, and again I'll put my fingers on the vertebrae. I'll drop off the base of the skull onto about C2 and the transverse processes, C2, C3. My fingers will kind of be in this position, and I will just gently massage or press on the area of the muscle. I honestly find that to be much more useful than dry needling. Well, I tend to dry needle a lot because I find that to be much more effective and time efficient. But in these cases, I tend to use a massage rather than dry needling, but we can dry needle in the directions we just mentioned. Splenius cervicis, needling is a similar position for splenius capitis in side lying, a 30mm needle. I'm basically going to try and needle into the in between my fingers. Again, placing the needle there, lateral medial direction, and I only want to go to the depth of the muscle, so I'm going to be very gentle here. I need to be very careful when I'm needling. Now this way I'm going in a posterior anterior direction, and I don't want to be doing that. I would rather be going in the direction of anterior to posterior between my fingers here. I just get you to lift your head up and relax. Just twist your head towards me. Relax, relax, relax. I found the muscle, so as I can, anterior to posterior direction, possibly a little bit inferior, just to the depth of the muscle. This is why a smaller needle is better. I've used a bigger needle with a nice big tab on it so you can see, but that's the direction we would be going to needle splenius cervicis.